The lung. So, with the artery, this one isn't separated off the way some of the others of yours are, but you've got the main dorsal aorta coming down the middle, and then so that's the middle there. What you're seeing poking through from the other side, that's another lung. So the middle is right here. The first artery branching off the aorta up to the stomach, right here, which has actually got some blue in it on this one, that's your gastric artery. Alright, then you follow the dorsal aorta down, and then your next major branch off the aorta is the celiaco-mesenteric here. So it's pretty similar to your cat, your celiac trunk in your cat. So in the cat you have the HUGs. What does HUGs stand for? HGS.
Hepatic gastric splenic.
Hepatic gastric splenic. So you have a hepatic and a splenic, you just don't have a gastric on this one. You have a pancreatico-duodenal instead. So, celiaco-mesenteric, you can see a little V, and this is something you probably just have to get your head closer when we're done, but your left branch of the V is going up towards the intestine. Some of yours will actually show that going all the way to the intestine a little bit better than this one, but this one shows the branch better. So left turn, from at least this direction, pancreatico, what did I just say? Duodenal, sorry. Pancreatico-duodenal. The one that's going to go straight back, in this case, to the liver. What goes to the liver in the cat? Which one? The hepatic, yep, so that's the hepatic. And then there's one that makes a right turn over here and goes to the spleen, so which one's that? Splenic. Then for the arteries, the rest of these, going up to the intestine and all the mesenterics, there's lots of them. Then the intestinals are the little teeny tiny V's right next to the intestine. That's the part that's the intestinals. For the arteries, they differ. For the vein, you only have one mesenteric, and it runs right through the middle here, this big guy. That's the single mesenteric, and then all of these larger ones going up to the intestines are the intestinal veins. So right next to them is the mesenteric artery, intestinal vein. Intestinal arteries don't happen until they get further up. Does that make sense? That can be really tricky. So look at your book. We can go over it again. Okay, so with the hepatic system, you've got the hepatic portal vein that goes through the liver here. Most of the Mudpuppies this semester are really dull colored. It's supposed to be bright yellow coming through here. That branches into two, so the one we already went over is the mesenteric. The other branch makes a right turn through the pancreas and joins the splenic artery. Of course, it's not called the splenic vein. It's called the gastrosplenic vein, but it's right alongside the splenic artery going to the spleen. So gastrosplenic splits at the spleen, goes into the spleen and becomes splenic, which you can't really see, goes up to the stomach and becomes gastric. So remember that your gastric vein and your gastric artery are actually very separate from each other on the Mudpuppy. My gastric artery in the Mudpuppy is way up here. Gastric vein comes from the spleen and goes to the stomach. Your big blue guy here is the post cava, posterior vena cava. So it goes in way up at the top up here, at the top of the liver, comes out at the bottom. Don't forget in your lung system, whether it's the cat or the Mudpuppy, deoxygenated and oxygenated blood switch between arteries and veins. So if you see a red vessel running through your artery in the lung, it's a vein. If you see a blue vessel, it's an artery, only in the lungs. Same with the cats. Segmental arteries are all the way up and down, these little short pieces here. This is a male, so this is the testes. So that's your gonadal or testicular arteries and veins feeding the testes. This is your bladder way down here. Underneath the bladder is where you're going to find your kidney. And pull this apart just a little bit more. Make that a little easier. So that's the kidney way down here. You have a renal portal vein along the edge of the kidney, just like the shark. Usually not something you can really see though. It's the mesonephric ducts kind of cover it and it's not well injected. So when you see something running along the edge of the kidney, that's actually the mesonephric duct. in the male. So this saw them as an efferent duct here. In a female, if you saw squigglies like this, that would be the oviduct. We talked about that earlier. Bladder. And what else have we got? Anything else? Posterior cardinal vein. Are like the shark, they run alongside the dorsal aorta, so it's kind of hard to really delineate between them, but I think there's some better mud puppies for trying to show you that. But basically you have dorsal aorta, and actually I think Erica.
Yeah.
Erica and Robin, you guys have a good mud puppy for posterior cardinal veins because you can see the dorsal aorta and you can see the posterior cardinal veins on either side of it.
Can you show us the mouth?
Maybe.
My mouth is not all that great.
It's better than mine.
Yeah. So the ones you can usually see best going up the middle here, that's the internal carotid. You're not really going to see vertebrals because they're too thin and they don't get injected. And that's really all you're going to see. Sometimes you'll see your externals, sometimes they're on this side.
The radix aorta, right?
The radix, yeah, the radix is going to be in here. It looks exactly like it does in the shark, where it comes up and it goes left and right. Radix, except it's a little bit bigger proportionally in the mud puppy, and this one doesn't show it. Yours does really well. And then sometimes the external carotid will be up here, but you know.
I also have one of those.
Yeah. So you should look at Robin's mud puppy for all of that, because this one doesn't show it very well. And the heart's a little kind of exploded too.
But I'll get cheese on me.
Oh, the last two things are there's two vessels you can see in the arm. And Frank corrected me on this one last time. I thought there was only one. So right between the two muscles here, you're going to see the brachial. And in the armpit, depending on the animal, or you remove the scapula and you can see the axillary. You won't see the subclavian on the mud puppy. So
those are the only two we need to know in upper body?
For the arms.
Yeah. What about the lower leg? Is there anything in the lower leg that we need?
Iliac, if this were open far enough.
Oh, that's right. It's on the inside.
Yeah, I mean, it's going right to the leg, so it's the only thing that's crossing across at the bottom.
Okay. Cool.
So, yeah, way in there, the one that's kind of the red artery going to the leg, that's the iliac. Don't worry about the femoral. And who did I open the scapula for?